Hi, my name is Lorenza Valdivias, and I will be talking about the stakeholder educational plan regarding effective pain management and end of life. My stakeholders include a quality improvement coordinator who keeps track of performance of organization by collection and analyzing data, conducts quarterly meetings to discuss deficiencies, and proposes methods for performance of improvement. It is a key person when it comes to data collection. We've also got the medical director and the medical staff. Medical director authorizes implementation of proposed plans for change, and medical staff who are in the field are able to give input regarding deficiencies in performance and report to the medical director and quality improvement coordinator at quarterly QI meetings. The administrator, next to the medical director, also gives authorization for new projects. On top of that, they also give authorization for budgets. So they are the key person when it comes to budget setting. The team manager, who manages different teams and different staffing on each team, can help sell the idea to the field nurses and will assist in implementing and informing the field nurses of the plan. The field nurses are definitely very important for the project because they're the ones who will implement the intervention in the field and will assist in the data collection to measure the outcomes. There are different educational needs that were assessed for each stakeholder. My quality improvement coordinator would have to be educated on the data collection tool that would be used, and they might also collaborate in creating a data collection tool, and also give input on how to interpret the data because that's their specialty. The medical director and the medical staff will have to be educated on the current issue and what the proposed solution and intervention is, what the outcomes may be, and what the cost of the project will be as well. The administrator will have to know the cost of the project as well as the time frame of the project. And the team manager will be educated regarding the intervention itself, teaching techniques to be able to teach the field nurses, and will also teach them techniques on troubleshooting. If field nurses do come across any issues, how those issues are addressed, and how solutions are implemented at that point. And the field nurses, of course, will have to be educated on the intervention itself, how to implement it out in the field, and also how to assess for the outcomes of the intervention. The teaching theory that I'll be using will be based on andragogy, of course, which means the art and science of helping adults learn, which was developed by Malcolm Knowles in 1980. Andragogy is based on the fact that the learner is motivated to learn by internal factors, and the educators should set a cooperative climate for learning, assess learner specific needs and interests, work collaboratively with the learner, and explain why something new is being taught. Adults need to know why they are learning something. Effective teachers explain their reasons for teaching specific skills. We don't like to be told to do something without being given an explanation as to why. So it is very important for the teacher to explain why something is being implemented. Otherwise, you're going to run into a lot of resistance. Observational learning is also another part of the teaching theory that I'll be using. Of course, we do know that learning takes place by observing another person, and I'll be doing that by, of course, a PowerPoint presentation and then going out in the field with the staff nurses, the field nurses, to teach them how to use the tool that will be implemented. The outline of my plan would start with collecting data, such as satisfaction surveys from patient, family members, clinical staff, such as the nurses, the field nurses, and the field doctors, to get some feedback on the deficiencies of this issue. Then, of course, I'm going to be researching the current interventions and studies conducted on the topic, summarize the evidence-based practices, and in summary, deliver to the stakeholders the information that was collected from the resources that were used. I'll create an informative presentation for the proposal involving the primary stakeholders, who are the QI coordinator, medical director, and the administrators. And then I will create a second presentation of the implementation techniques, who will involve the primary stakeholders and the team managers, as well as the field nurses at that point. The outline of the plan will include information for stakeholders that will consist of educating them on the current issue and the concern that is being addressed, which is providing effective symptom management at the end of life, and for patients that are nonverbal. Sometimes at end of life with nonverbal patients, it's difficult to differentiate between pain management when a patient's having pain and when a patient's having different symptoms that need to be addressed. So that's the issue, the current issue that's being addressed, what the positive outcomes the implementation will have, of course, providing more comfort care at end of life for these nonverbal patients, and how the progression of the project will be followed, and how the stakeholders will be kept up to date as far as what the progression is, so that plan would be addressed, and how stakeholders can help facilitate the project, meaning what they can do to assist with the implementation of the project.